I'm writing a story about mental health providers in rural Oklahoma. There's a real shortage of mental health providers in rural Oklahoma in all types of different fields in mental health, including psychiatry. I met with Dr. Leland Dennis, who is a psychiatrist in Elk City. He will soon retire and leave that area, leaving the area with no psychiatrist in any sort of distance nearby. There's a lot of telemedicine going on in rural Oklahoma for behavioral health, but as far as someone in person doing treatment, there's a real lack of that. Dr. Dennis talked about how he works closely with a local primary care provider to deliver mental health, because what a lot of people probably don't realize is that primary care providers provide a lot of mental health because their patients come to them and start talking, and then they can do some interventions and screenings there, which Dr. Dennis and this doctor work together to do.
One of the things that you asked me to talk about was access to mental health care in rural Oklahoma. And so I just wanted to make sure. I don't think it's a problem, I think it's a crisis. It's funny, when you look at the 20 plus years I've been doing this, it has changed dramatically. If you look back in my career, we really were a system when I started. And I think that comment, what system, is very accurate. But one of the things I think my patients face here is common but worse in rural Oklahoma than urban Oklahoma is the stigma. You know, in Oklahoma City, Edmond, Norman, you can be anonymous. Here, it's almost impossible to be anonymous. You know, if you have a mental illness, you're noticed. People understand that, especially if you have one of the more severe and persistent mental illnesses. There is a great deal of resistance to seeing a psychiatrist. There's one of the things that I think happens just looking at the doctors in town, at different stages in the career of a doctor, they'll ask different questions. Dr. Phelps probably was very reluctant to refer to psychiatry early, based on what he said, because he hadn't asked those questions. And so delay to getting into a psychiatrist is the norm. Not only getting in because you made a decision and tried to convince the patient that they needed to go see a psychiatrist. No, you're not crazy. I tell people that a lot. I don't take care of crazy people. That's not my job. You know, I take care of people who are ill. I'm very much a medical model. You have depression. I can do genetic studies on you and show you why I think you have depression, which drugs are best to use. And you know, I try to normalize what they're seeing. I'm a psychiatrist that approaches my practice believing that mental illness is just that. It is a physical illness that's expressed in mental terms. Okay, so I see depression and anxiety as processes in the brain, just as I see the function of the heart to circulate blood, and oftentimes they're very interrelated. A person who has a heart attack that goes on to develop a depression has a much worse outcome than a person who has a heart attack and is treated for their depression.
It's extremely valuable for me to be able to work with Dr. Dennis and his psychiatric expertise because we're trained more in a, not nearly to the extent that he is in trying to deal with these more significant problems, and certainly I think that they are becoming, number one, we're more aware of these problems, but I think they're actually more frequent. We know that dementia is increasing, we know that depression is increasing, we know that anxiety with the times is increasing. There's so much more psychiatric interplay with medical illness that it can be invaluable to be working with an excellent psychiatrist as Dr. Dennis. Of course, I have admitting privileges here in the hospital. I actually had that similar thing happen with a young man that I've taken care of and that I've consulted Dr. Dennis with, who was having a problem with bipolar disorder, depression, etc. And so I can admit them to the hospital as an inpatient. Yourself, I could admit you to the hospital as an inpatient, consult Dr. Dennis as a specialist to help me with the care and the therapy. And we've done that many times to get over the crisis situation. So the fact that he's here allows me to be able to do that with his helping me through that process.